Reducing the impacts on human health is one of the driving forces for climate action. The World Health Organization has published a number of well-known studies addressing the link between climate change and human health.
And we are very honored to have the expert on these issues here, the director of the Public Health and Environment Department at the World Health Organization. Welcome, we are very proud to have you here, Ms. Maria Neira.
Excellencies, dear friends, this is not normally the way we start medical congresses with this funny music, so thank you very much for this opportunity. Certainly for me, for a physician, for a public health officers, having the opportunity to include health at the center of this summit is really something that makes me extremely happy. I'm sure by now you are all extremely convinced of the reasons why we need to take more action. But if it's not the case, I would like to give you, they told me I have 10 minutes, so I would like to give you 10 reasons why we need to do more. The first one is probably the most dramatic. According to the World Health Organization estimates, a report we did recently, there are 12.6 million deaths that are occurring every year and are related to environmental risk factors. If this is not a reason to do more, what else? The second reason, and this is probably a little bit more positive and action-oriented, is that all of those environmental risk factors are modifiable. So we can do something about it. We can even present these facts in positive. Means that every year, if we take the right environmental decisions, prioritizing health, we could reduce almost 25% of the global mortality, which is related to exposure to those risk factors. So I think, again, a very powerful reason why we need to do more action. Number three is that 92% of our population right now is breathing air that is not following the standards proposed by the World Health Organization. There are people breathing right now air that, in fact, is killing them. We have every year 6.5 million deaths that are caused by exposure to air pollution. There are new generation in some countries that certainly I will not nominate because I don't want to create any enemy in the room, but they think that the sky is gray. They don't realize that it can be even blue sometimes. And this is in the name of industrial revolution and industrial advancement. This is not really the case. The price of this so-called economic advancement is paid by our lungs, but by our cardiovascular system. And this is where we can have another very good reason to go for more action. Almost 40% of the global population is now cooking or heating their houses or lightening their houses using dirt, very dark fuels, fuels that are causing a lot of problem for their lungs because they are inhaling these very, not clean fuels that they are using at home, and we cannot accept this reality for almost half of the population in the planet. This is another powerful reason I think we need to do something about that. Plus, of course, in our cities, our mega cities now, where 70% of the world population will be living in 20 years from now, all of them are exposed to this terrible air pollution where we have a great opportunity to reduce that major burden that is causing our health. Let me now move on reasons that are a little bit more positive and probably more opportunities than anything else. The first opportunity is about urban health, about healthy urban planners. We want mayors, we want governors, we want local municipalities and authorities at the local level to be the best possible ministers of health, because you are the ones who have the possibility of engaging in multi-sectorial action. You have the possibility of proposing a healthy and sustainable transport system that will result on reducing this terrible sedentary lifestyle that we have in our cities, the fact that people cannot move, cannot be active, and again resulting on non-communicable diseases that are representing a major challenge for our public health. You can as well propose access to clean energy, sources of clean energy for all the citizens in the city. You can propose energy efficient, and we will be there to give you the health arguments to select what are the interventions at the city level, at the urban level, that will generate more health. We can even do more. We can quantify the health benefits that can be obtained anytime you take a decision at the political level on moving on a certain energy choice or transport choice. We can quantify how this is benefiting our health, and this can be a very powerful and positive argument for our population. Citizens understand when interventions are taken in the name of the protection of their health. I think the mayors of Paris or London or Madrid recently, or Mexico or New Delhi, they know very well what I'm talking about. The other opportunity, and I think we are on number 6, but I hope you are not counting, is about the Paris Treaty. Everybody's talking about the Paris Treaty, and for us, for the public health community, the Paris Treaty can be, if implemented, of course, one of the biggest, more challenging, and more ambitious health treaty of this century. But of course, we need you implementing it, because otherwise we will miss a lot of opportunities. Number 7 is about the SDGs. Everybody talk about the Sustainable Development Goals. One of them, the number 3, is about health and well-being. But for us, health is not only in the SDG 3. For us, for the health community, health is in the number 7, SDG 7, which is about access to clean energy for all. Number 6, which is about access to clean water. Number 11, which is about healthy urban development. And number 13, which is about climate change, among many others. When I was trained at the medical school, of course, they were telling us how to treat patients. Now, we don't want just to treat patients. We need to influence and make sure that we reduce the causes of the diseases that our patients are suffering from. And this takes me to the opportunity number 7 or 8, I don't know, which is that the health sector can lead by example. We can very well, as doctors, as physicians, as nurses, and all the members of the health community, reduce the carbon footprint of our hospitals, of our healthcare facilities, and many others. And believe me, greening the health sector, making our health communities more sustainable, that will be a major financial contribution as well, and a stimulus for the medical community, the public health community. Doctors are still a little bit influential, so we think that this could be a good contribution for all of us. And the last one, the reason for all of this is that, after all, the public health community invented many years ago the term of primary prevention. And in fact, all we are doing here on promoting a sustainable development, on fighting climate change, there is nothing but primary prevention. It's tackling the causes of the diseases. It's making sure that we will create a healthier environment that will be contributing to our health, to our more sustainable. There are plenty of costs that are not considered in all of this agenda and discussions about health arguments. The health cost has not been included in the discussions on the UNFCCC and other experts. The health cost means that 12.6 million deaths is a horrible toll, but in addition to that, because they are suffering, the patients are suffering from chronic diseases, non-communicable diseases, stroke, cardiovascular disease, ischemic heart disease, this will require a very long periods of hospitalization and resulting in a major cost for our countries and our health system. So use that health argument because it's a very powerful one. And believe me, the health benefits that can be obtained on tackling climate change, on reducing air pollution, on reducing the environmental risk factors will be something fantastically. So even if we are not convinced of doing it, or our population don't see the reason to do it for the planet, for the future, for the sustainable development, for economic reasons, I think they will be very sensible to the health argument. So we are ready to work with you on making sure that this health argument is well understood by all, and this will be the leitmotif for doing more on environment and sustainable development. Thank you very much.